Hi, I am from Canada and I am about to go receive Shockwave treatment. So I have a condition that is sort of called PGAD. Oh my god, this is why it's so bad. I may have a condition called PGAD, which stands for persistent genital arousal disorder. It's also known as genitopelvic dysesthesia. And I'm not entirely sure if I do have that, as the symptoms are somewhat different from what I experience. But what I do experience is a hypersensitive clitoris, very sensitive to pain. And when I stimulate myself or a partner stimulates me, it's painful and it goes numb and then itchy, and then I have a painful orgasm. So sexual activity for me has always been unenjoyable and has caused a lot of problems in my life and my relationships. So at this time I don't experience any pain just in standing here, but if I do go touch myself or someone touches me, the pain can range from like a 1 if I just don't do anything, just light touching and never try to pursue an orgasm, to like a 9 or 10 if I push myself with some extreme stimulation. But if I try to keep it really gentle and really go low and slow, it might end up like a 5. So that's like my best case scenario, is an orgasm that has no pleasure and hurts at a 5 on a pain scale. So I'm really looking forward to trying this and seeing if it helps me at all.
Okay, and what about, do you want to tell us about any back pain or the cyst that you have?
Oh yeah, so I don't have any back pain, besides maybe normal back pain, like just lower back pain from standing and stuff. But if that improves, that'd be amazing. And I also was diagnosed with Tarlov cysts in 2017. I went to see Dr. Irwin Goldstein after about 15 years of trying to find help from doctors and therapists, and I couldn't find anyone, and Dr. Goldstein finally took me seriously. So I talked to him on the phone actually first, and he diagnosed me with clitoral adhesions and Tarlov cysts over the phone. And I went to see him, and he examined my genitals, and he said, "You have clitoral adhesions." And then I got an MRI, and it showed Tarlov cysts on the exact nerve roots that he said they would be on, which always blew my mind. Then I had diagnostic injections to prove that the cysts were causing my pain. Unfortunately, they didn't prove that they were causing my pain, but they also did not disprove, so that doesn't necessarily mean anything. So we are going to be targeting those Tarlov cysts as much as we can with this treatment, to see what happens, because that would either help us to rule them in or rule them out. Just finished my first Shockwave treatment, and it was definitely not as painful as my hand. In fact, it was mostly just like a bit achy in certain spots and not achy at all in other spots. I think it lasted probably like maybe 10 minutes, I'm not sure exactly. But it definitely wasn't scary, and I definitely think anyone should try it if they're thinking of it, because it's not so scary that you shouldn't try it. It's definitely better than a lot of other treatments that are available in terms of pain and scariness. So I think right now my lower back's actually a little bit achy from the treatment, but I don't think that's going to last. And other people have said that their pain has gone away, I think within a week, even if they had like quite a bit of back pain. I did go check how my clitoral sensitivity was after, and at first I thought there might be some reduced sensitivity and sensation, and then it became unclear, so it still seems to have like some hypersensitivity. So I'm going to wait a couple hours and then also check in again in a couple days to see how that goes and return and report.